Get social with us. Follow us on Instagram at Goodtaste TV. When it comes to Mexican food restaurants in San Antonio, a few names come to mind. Los Barrios, La Hacienda de los Barrios, and Viola's Ventanas. All are family-owned and operated local restaurants. These restaurants have been featured on Good Morning America, The Today Show in New York, along with many other national and international programs. The Barrios family have been in the restaurant business for more than 50 years in San Antonio. Come join the fun and become part of the family. Hi, everyone. Welcome to Good Taste for the Soul. I'm Tangi Patton. Good Taste covers a lot of ground. We talk about good food, good wine, and we meet fascinating people with heartwarming stories of survival, stories of renewal, all kinds. I had a conversation with a doctor recently who made a comment that got my attention. What if you feel great, but when you look in the mirror, you don't look so great? I've been there. Maybe you have too. And it can change your entire mood. Well, my guest today says he sees people like us all the time, and his goal is to get them looking as good as they feel. Please welcome Dr. Manny Lopez to Good Taste. Hey, welcome, Dr. Manny Lopez, plastic surgeon in San Antonio, but I can tell you people from all over the world, I don't think that's an overstatement, travel to meet you. Welcome to Good Taste for the Soul.
Tangi, thank you so much for having me. It's a pleasure.
Well, I know a lot of folks, men and women, are going to be very interested in what you have to say. And it truly was a conversation we had recently that sparked my thought process along how to talk to you about this topic. And you said that you often have women that come in and men and say, I feel a lot better than I look.
Absolutely. So, what I tend to do, my goal is always to get people looking as good as they feel. So, fortunately, now with exercise and diet, people understand how to live a healthier lifestyle. But unfortunately,
Right.
when it comes to the face, exercising really hasn't been there isn't really a way of doing exercising for your face. I mean, people do facial exercises put on a repetitive basis, kind of like we go to the gym, just doesn't quite
Right.
happen. So oftentimes I try and now kind of turn back the clock so that when people look in the mirror, they look as good as they feel.
And do you think sometimes it can be psychological if you feel you look better, you feel better? I hope that doesn't sound too superficial, but you know what I'm
Absolutely.
saying?
No, I know exactly what you're saying. In fact, Allergan, the makers of Botox, have done studies on that. And people, when they get Botox, when you get rid of the frowning, the lines that cause the squinting, they feel better about themselves. And not only that, people perceive them as happier. So
Really?
it's not just what my thought is, it's actually been studied to where people are perceived as happier. And it's kind of intuitive. If you have these lines here that are causing that scowling look, even though you might be the most pleasant person, you portray yourself as an angry individual. And so a simple procedure like just doing Botox to weaken those muscles to make those lines disappear can make a significant difference in how you're perceived and also how you feel about yourself when you look in the mirror.
I gotcha. All right. So in terms of let's we all want to, feel good. We all want to look good, feel our best, look our best. Let's take it from an age standpoint. At what age do you think it's appropriate to start thinking about things like peels or Botox? I mean, where should someone start?
Really, so what we're talking about is when should we start worrying about the aging process, right? So when
Yeah.
we're in our teens, we certainly don't worry about how we're looking as far as aging. There's no sagging
Yeah.
going on. We've got this bright, beautiful skin, this glowy. So in our teenage years and even going into our 20s, I always tell people when they come in and they start looking for things, I just say, enjoy your youth. I mean, this
Isn't
is
that
like
true?
the best time of your life where you feel good, you're healthy, nothing aches, your skin's glowy, and you barely even take care of it, right?
Exactly.
So, but when you start thinking about, okay, I want to prevent the signs of aging, sun is one of our biggest enemies when it comes to skin. The UV damage that occurs can be significant over time. So when you're in your 20s, really, you need to protect yourself, not go into the tanning salons and not be out in the sun, kind of like probably when we grew up, Angie, girls doing
Oh man,
the
that's all you
oil and
did
such.
was yes, live for the sun.
Right, and get as dark as you can. And fortunately, that look has kind of gone away, and it's not as appealing. So early in your 20s, you should start thinking about, okay, I'm going to protect my skin from the sun, and that's just a good sunblock, and also just good habits. There
Okay.
are also things you can start thinking about because you get some hormonal changes in your teens and 20s. So protecting your skin from acne. So acne, and I can tell you, I see it almost on a daily basis where people unfortunately had terrible acne and now they've got scarring of their face. So again, everything when you're in your youth, in your younger years, it's about prevention. So if you're in your teens or early 20s, you're having acne, really be aggressive in treating that. And that could be simply a good skincare regimen.
Mhm.
Oftentimes we use retinols or retin-A's, and also facials that kind of keep those pores open, keep that skin healthy. We do teen facials that can help that glow, cleaning the skin. 'Cause, a lot of kids are not as consistent maybe with their skincare like they should be. We have 5 kids, and I've seen them growing up, and as they mature, they get better and better. But definitely teenagers are tough to get on a consistent program. But the teen facials do a wonderful job of cleaning the skin, getting on good skincare. Again, going to your 20s, I think that's a great process to continue. As we get into mid late 20s, now we're getting this muscle movement around the eyes where we talk about wrinkles, dynamic wrinkles, wrinkles with motion, and then wrinkles at rest, right? So when you're in your teens and early 20s, you have no wrinkles.
Right.
Now we start developing some wrinkles with motion, and those are usually the 11s, the crow's feet, and then oftentimes we have dynamic forehead wrinkles.
Like
And these
smile lines and squints and things
Yeah.
like that.
And that's what people start noticing in their 20s. And that's where we kind of that baby Botox. We just kind of start weakening the muscles. I started at 29 because I used to have a deep line.
Really?
I did. And I
Really?
had because I got a kind of a depression here, some loss of volume. And so this muscle was very strong. And so if I'd be thinking, in medical school, I was thinking and my muscle was just contracting so hard. I wasn't angry, but it was just the muscle. That's what I did. And so you just stop that muscle contraction with something like Botox. And the other ones are out there are Dysport and Daxxify, kind of the Coke and Pepsi's, different brands, but the same idea where you're weakening the muscles to stop the lines that cause the aging. So
But
when
really
you're
in the 20s, that just blows my mind.
Oh my gosh, yeah. It's getting to
In
where
my
when you talk about rejuvenation, prevention of aging, you really need to start thinking about in your mid to late 20s because, like I said, I had a deep line already at 29. I just hadn't been
wow.
exposed to Botox until then. And so you want to stop it before you're causing that deep line.
So
There's
you're
the whole,
stopping it by freezing the muscle with that, right? And so
rather,
the
yeah,
muscle
rather than freezing,
essentially
I'd say
quits straining.
Right. We're weakening the muscle and we're weakening it so it's not causing the contraction of the skin or causing the creasing of the skin from the contraction of the muscle, which causes a
Okay.
line. So it's very physiologic, right? It's not
Yeah.
like this magic potion. It doesn't erase wrinkles. What it does is it stops the movement that causes the lines on the skin. So you stop the movement, skin's a dynamic organ, that skin will then slough off and you get fresh skin that is no longer creased. So if you start earlier, you don't get that creasing at all. That's the benefit of starting early. You're
You're
starting before
delaying, right?
you're preventing, not just delaying, you're preventing.
Preventing too. Oh,
Correct.
okay. Both.
You're preventing it because the cause of those lines is the muscle contraction.
Yeah.
So if that muscle is not contracting, then it's not going to cause a line. It's not gravity dependent, it's purely the muscle. So you're preventing it by stopping the movement that caused it. You're getting rid of an unwanted facial expression. You don't need to scowl and squint. That's an unwanted look.
Right.
Yeah.
Yeah, I'm just
So
sitting here thinking, I wish I'd met you in my 20s.
yeah. Well, that's the thing is Botox has been around since about they started testing in the 80s. It got FDA approval in 2003 for the glabella, the area between the eyes. So it is, I mean, it's been around now 20 years FDA approved, 40
Yeah.
years actually in studies and all that. But it's been a wonderful treatment for prevention of aging changes around the eyes. And then we use
Yeah.
it in other areas as well.
Okay. So in your as you're approaching the 30s and those late 20s, you want to start some prevention
Right.
in addition to maintenance, right? So what about for me, 30 was a mind-blowing birthday. I didn't mind 40 so much, but there was something psychological about 30.
Yes.
So what do we need to be thinking about in our 30s?
So once you get to 30s, you start seeing a little bit of volume loss.
Yeah.
And that's when we start thinking about, okay, my lips aren't as plump as they were when I was in my teens and my early 20s. So that's where you start seeing some volume addition to the lips to have that plumpness that not
In the
in the
30s?
Oh, absolutely. We have patients in their 20s that just have naturally born with thin lips, right?
Yeah, I
So
can see that.
absolutely, lips can add a beauty to the face that can more femininity as long as it's done in a very natural way. That's the problem. Like anything overdone looks unnatural, and that's where
And don't
people.
you think
Oh, go ahead.
I think to me, this is personal opinion, I see more overdone lips than I do Botox freezes. Does that make sense?
It does, and you know why? Because you don't notice the good lips. You think they just have naturally good
I
volume.
bet you're right. I never
I
thought of
know.
that.
Yeah, and the reason why you don't know you notice to over freeze a face, again, you shouldn't be really you don't notice it in the glabella, which is this area here, or the crow's
Mhm.
feet. Where people notice it is if they're not getting the smile, the excursion, the smile, or if they're so Botox in the forehead that they may have dropping of their brows. Because remember, it weakens the musculature, and so if you overdo the forehead, it'll actually drop the brows because the muscles here
Yeah.
lift the brow up, right? And we want to have that beautiful look in the eyes. And so overdoing Botox is much more difficult to do than overdoing filler. And obviously, in the lips, which is the central part of the face that we're highlighting with lipstick, if we're overdoing them, it just is so unnatural. It just stands out.
Oh, it does. It almost looks like a platypus or something,
Yeah,
that
it doesn't
front.
look right. And that's why you go to somebody that you trust, that you appreciate their
Yes,
aesthetic. We're number one in all of South Texas for Botox and fillers. We have wonderful injectors that do a phenomenal job. And our aesthetic is a natural result. Whether it's surgical injection, anything we do, it's not to see how much volume we can put in. It's creating a nice facial harmony, facial balance with using the tools that we have.
okay, so maybe can start consider if your lips are thinning,
Lips are thinning. You
going
also
to
can
a
have
good
go ahead.
a doctor or esthetician you trust and know does restorative and not massive lips, right?
Right. Now, estheticians do more of the skin treatments. We have 7 estheticians. It should be either a PA or a nurse injector, right, that do the
Ah, okay.
injection.
Well, that's
Uh,
good to know because I would imagine the rules aren't always followed in some places, so that's good to know.
they should be, right? But yeah, so
Yeah,
I think it's incumbent upon each individual to understand who's doing the treatment, that they're well
right.
trained, and you want to go to somebody that's reputable, right? It's not always about trying to get the least cost because that can sometimes be the costliest. So, kind
Exactly.
of talking about what we want to be doing to prevent the aging process, we've kind of gone over the teens, which is basically just skincare, preventing acne. In your 20s, same thing. And then as we get into our later 20s, if we have the habit of causing lines, we start thinking about Botox. Into our 30s, we start seeing a little bit of volume loss, which could be around the mouth. And
Yeah,
that can even happen in our 20s. And then we also start noticing a little bit of volume loss here. Our cheeks aren't as supple as they were before. You can actually, again, when we're talking about volume, we lose starting in about our 30s. We start losing about a cc of volume or so in our face. So we start losing volume in our face. You want to replace it, and that could be done very naturally with hyaluronic acid fillers, which are the Restylane and the Juvederms that I'm sure many of your listeners have heard about,
right.
which are completely different than the Botox and Dysports. So
Okay.
in our 30s, we start thinking about adding volume, still taking care of our skin, still preventing the unwanted facial expression. And now, one of the most exciting things that we've recently added about a year now into our practice has been muscle stimulation of the face. We talked about earlier how we can work out our body, but can't really work out our face. Well, now
Mhm.
we kind of can. There's a technology for years now where you can do muscle stimulation of different body muscles. So your glutes, your abdominal muscles, and the treatments were called either M Sculpt or Cool Tone were the two devices that were doing that. And I've been asking it for the face for
Right.
years because the face is full of musculature. And what happens is as we age, like every muscle, you lose tone and volume of the muscle and strength of the muscle. And so what happens, these muscles that are usually keeping the face up can become starting sagging like the rest of our body. And that's where you start seeing the jowling and you start seeing the what's called mid-face ptosis, which is the mid-face coming down. Once that's occurred, that's now we kind of come into my realm, which is a surgical realm of needing to replace it and restore it. But you can, again, prevent that by doing a procedure called TriLift. TriLift is an exciting device that we brought in and now had at all three of our locations in Alma Heights, Bernie, and Sonterra Place because it is a muscle stimulator of the muscles of the face. And it's a procedure that takes about 20 minutes to do. And because it's muscle, the downside is you need to do it frequently, which is we do about 5 times a week apart. And then you do about once a month. And you're keeping that
Wow.
musculature of the face healthy, which
Okay,
we've
that's
not
a new
had.
one to me. I have not heard of that.
No, in fact, like I said, we've had it in our practice about a year now, and the beauty of it is I've done it probably 8 or 9 times, and I'm going to continue to do it just like I've been doing Botox as long as I have because I was a physiology major at UCLA, and it's got to make sense to me, right?
Right.
This makes total sense to me. If I can stimulate this musculature, I can delay the jowling and laxity of the face that happens over time that's due to the musculature, right?
Well, can any age benefit from doing that tri-lift thing?
Great question. So I just had a patient today that came in with heavy jowls, heavy neck, and she goes, I want to do that tri-lift. That sounds great. I said, that money will be thrown out the window. It won't
Yeah.
work at all because it's a prevention device for the most part versus an actual correction when you have a significant
Okay.
laxity. Now, where it works well is kind of that, like we are talking about, in your mid to late 30s, early 40s, preventing we know the musculature is going to become less strong. And so you can strengthen it and keep that tone up. Or we also have people that are going to a reunion. They haven't seen these people for like a high school reunion for 30 or 40 years. That's a great treatment just to get, like, when you go to the gym and you feel bulked up right afterwards from lifting, you
Yeah.
get that same result in your face. So you do get a
Oh,
tightened
how
look,
interesting.
but it does go away, obviously, next day or two. But you do it the day before your event. In fact, they're doing this for the big celebrity Oscars and such like that.
Really?
Oh yeah, to get that little tightened accentuation. So Trilift's been a wonderful addition. In fact, super popular because again, it's a natural way of restoring the musculature of the face, so you get the tightening effect and there's zero downtime. Like I've done it before I've done it, and I've run into a patient right afterwards to do the consultation. So
Yeah.
there's zero downtime. There's nothing changes in the face. It's just you're just plumped up
Huh,
yeah. So
that's
it's a great thing to start thinking about when we're talking about prevention of the aging process uh, by doing the muscle. Now, what else happens as we start getting into our 30s and then in our 40s, we start losing collagen, right? Not only do
yes.
we lose collagen, we actually get disorganized collagen. So the collagen we have is not as taut as we had when we were more youthful. So treatments that can stimulate collagen and elastin are very beneficial. A wonderful treatment is Morpheus 8, which again, we have at
Mhm.
all of our locations. Why? Because it's super important to restore that collagen elastin, and I can't do that surgically. So if you're
Right.
talking about a 30 something year old that's like, I'd like to keep looking youthful and not worry about surgery for like decades, take care of the muscle, take care of the elastin and collagen, take good care of your skin, stop the lines, you'll be good for a long, long time, right? If that's your process.
Right. Well, like I say,
Morpheus,
I wish I'd taken this a little more seriously when I was down in those decades we're discussing right now,
that's
because
right.
but I have done the Morpheus a few times,
Yeah.
and The one thing I noticed on it was skin texture was
Yep.
just like once you get through, and it really, the recovery wasn't bad. It was much easier than I expected.
Less than
And
24 hours. Yeah.
it really was. And but then once you're done with the dryness, that skin texture was
Yeah.
pretty amazing.
Mhm.
You got the glow back and
There you go, the glow, exactly. So you get a
yeah.
little bit of tightening, and deep, you're getting that elastin collagen stimulation. You're getting improvement in the pore size. So there's a lot of benefits. And the nice thing about that one is, usually we recommend 3 treatments a month apart, and then you're done. You might do, one every year or so just to maintain it. Uh,
Yeah, you get to the age where it's all maintenance.
yeah, everything is maintenance, right, Tangi? And we
Yes,
got
it is.
It's
And
just like going to the gym. You can't go to the gym one time like, "Okay, I'm healthy." You gotta
that's
keep
right.
working out, right? And,
Uh,
that's how you maintain that youthful look.
yeah, and I hate to say it, but the older you get, at least on my end, the list gets longer and longer. It really it does.
Hey, your list is working for you, I will tell you that.
Well, you I'm grateful to know you, even though I met you later in my decade cycle. So
Yeah,
I'm grateful for that. Okay, so in our 30s, we can do. There are some fun. I say fun. Yeah, I guess if, for the results, they are procedures we can do to kind of help skin tone, a little bit of lifting, perhaps. Of course, the Botox and all that. And then, what are some of the things I think for a lot of women and maybe men too? I don't know. I always think men don't care about aging. Maybe y'all do. I don't know. Um, the 40s, because to me everyone, that's always been the age that is sort of symbolic with aging, although I don't agree with that. But
uh-huh.
in the 40s things do start changing.
Yeah, absolutely. So first of all, men do care. In fact, I just did a facelift on a man yesterday, and I've had, I think, 2 consultations on men today. So the answer
Wow.
is yes, they're becoming more and more aware, and it's becoming more and more accepted to want to look youthful because we want to look good too. If we
Yeah,
feel good and we're working out, we want to look in the mirror and feel good about what we see as well. And so the answer is yes, men do care, and men are doing Botox, and men are doing filler and Morpheus 8 and all these good things. Now, again, the majority of our practice is female, but
yeah,
the numbers of men is definitely growing, and it's going to continue growing.
interesting.
That's nationwide for sure.
Yeah, yeah, you see more
And
ads, cosmetic ads and whatnot geared towards men.
yeah, exactly right. Yeah. So again, it makes sense. We're always behind females, right, guys? We just take a little longer to figure it out.
Well, I'm glad you said it and not me. But
It's the truth. So yeah. So as far as now, we're the nice thing about your 20s and 30s, there's no, we didn't talk about downtime. You really don't have to worry about downtime. More if you say, like you said, less than 24 hours. You're red that day, you're back the next day. Tri-lift, you're no downtime. Botox, no downtime. Filler, no downtime. Now, what happens? We start getting into our 40s. We start getting a little bit of laxity, right?
yeah,
And so, what's the first thing that we start now needing my expertise is generally the upper eyelids. So we start noticing it's like, oh my gosh, I'm getting wrinkling of my upper eyelid skin, and I never noticed that before. My eyes aren't as open as they were before.
it's
And
like
the
a hood sometimes, mine were like a
Yeah, it's just hooded down, right?
yeah,
And it's very genetic. Some people get it earlier, some people get it later. And but the beauty of that is that's actually it can be an in-office procedure. It takes me under 30 minutes to do. You do it once, you never have to do it again. And it really is just removing that excess skin here. Opens up the eyes, pain-free. So we're still into the kind of the realm of easy procedure, not a bad recovery, but you are going to be out for a little bit because you'll be icing for 3 days, and you actually have an incision line that needs to heal.
right.
But when you're talking about what as we get older into our 40s, that's a very common procedure that we do to just open up the eyes. Another thing around the eyes is the lower eyelids. The lower
Yes.
eyelids, if you've got these bags or puffiness of the lower eyelids, people ask, do you have allergies? Are you not sleeping well? Are you tired? What's wrong? Are you sad? And so, a common procedure that we can do where there's actually no visible incision that's actually inside the eyelid is remove the bags. And so, by removing the bags, I'm telling you, it takes years off, and people quit asking, "Are you tired? Not sleeping with allergies?" That kind of thing. So common things in their uh, early 40s where you start noticing it is the upper eyelid redundancy
Mhm.
and the lower eyelid puffiness.
Well, I'll chime in on that lower. Doctor, you did mine, as you know, about a year ago. No, yeah, about a year ago.
Yeah.
And I waited. I really wanted that because I worked in TV all those years, and that was always an issue.
Hmm.
And, time is not always your friend on that kind of a thing. And I just kept feeling like all I see when I look in the mirror are these bags under my eyes. And I wish I'd done that 20 years ago. I really do. That to me was such a instant. I know maybe it sounds superficial, but it is what it is. I instantly felt better. I was stunned at how quickly uh, it looked better.
Right.
That was not a difficult thing.
No,
And it,
not it's pain free. I generally do it with a laser as well because that helps tighten that
yeah, I think
skin.
we did do a laser.
Yeah,
Yeah.
we did the laser, and so that's really your downtime is that healing laser. It's a CO2 laser, so it's about a 6 to 9 day downtime. But the beauty of that is it also helps to find lines around the eyes. So when you're talking about, you said it made you feel better. That's what I
Mhm.
love, Angie, is
Yeah.
yeah, what I do is make people look great, but more importantly, I make them feel great about how they look. Right. So
Yeah.
that's where I get my joy and reward for what I do is I people just come in they just look great about like have this aura of like just happiness. When you got these big bags, regardless of how happy you look, it just makes you look tired, right?
Yeah.
Not that you had big bags, but I mean, you kind of
Well,
lived
no,
through the right, and you can
I
only
my
put so much concealer.
it was always the thing, and when we were on shoots, I'm sure I drove the photographers crazy because it was like, "Do something with your lights," the editor would have to add a filter. I mean, they
Yeah.
were mine were, to me, quite big and noticeable, and it really was a mood lifter. I think we're all our own worst critic,
Oh, for
you
sure.
know, but, it really was a big mood lifter for me.
Yeah.
So I totally get that.
So, yeah, and again, having said that, remember, it's not exactly concrete. You have to wait till your 40s. I have patients in their 20s that just have genetically puffy
Yeah.
eyes. And so the nice thing about the 20-year-olds that have the bags, I can literally just go inside the eyelid, remove the bags, and not even laser the skin. So as long as they don't bruise, which really blood loss on the lower eyelid is like drops. It's not there's like
I
no,
didn't have a single bruise, yeah.
yeah, it doesn't bleed. And so they're back like they look great the next day. You might be a little swollen, but you don't have the laser because you're really not you don't need to
You
tighten the
don't
skin.
need it.
It's still
You
nice
don't
and
need
taut. So, but into your 40s, that's kind of where you start looking. Okay, I need some more than just the filler, more than just the Botox and skincare, and morpheus8 and Trilift. Now I need to do some surgical correction, and that's where upper eyelids are common, lower eyelids are common. And one thing we didn't touch on, which I think is also very important. In fact, I just had one about a week ago. There's light therapy and there's Moxie treatments.
Yeah,
So
I'm curious about those because now all the department stores, it wouldn't surprise me if Target or something like that didn't have 'em. They have all these red light devices, right?
So that's different. That's red light therapy, where supposedly it can help with the skin itself. Don't expect a lot of difference in that, right?
Okay.
Uh, but what I'm talking about is broadband light, which is basically filtered light that goes after a certain chromophore, like pigment or like reds. And
Mhm.
so, and then you can have a kind of a superficial resurfacing laser called Moxie, which is like what's called a 1927 laser, where it still has water as the chromophore, meaning it's going to go after the water, so you'll get some resurfacing and some brightening of the skin. And then the BBL, the broadband light, not the Brazilian butt lift. This is two different BBL. This is a broadband light at a Cyton. It is going to now improve the browns and the reds, and it's actually
Really?
shown a rejuvenation in the cellular composition. So you'll see improvement in the browns and reds, you'll see a brightening. And so that's other things that you can be doing. Again, in your 20s, I think it's too soon, but as you start getting into your 30s and 40s, and you start seeing, okay, I have some disposable income, I'd like to keep looking good. Those are wonderful treatments to continue to improve the appearance of your face, right? So the thing is,
Right.
we have like 30 something devices, Tangi. We have a lot. So we can't cover them all on this podcast, but I just kind of want to highlight certain ones that I think are really beneficial. And like I said, I just did Moxie BBL about a week ago, and that's something we do kind of like 3 a year. And
Is it a quick recovery? Is there much
so
downtime?
I had it done Friday, the 27th. I went to Eddie V's that night for dinner.
Oh,
So
so
it
you're
was
good.
that easy. And then I was seeing, and I did I saw my facelift patient the next morning because on my Thursday ones I see on Saturday, and she couldn't tell. I mean, it was a little pink. That's about it. So
Oh,
that's what
that's
nice thing
amazing.
is these no downtime or low downtime procedures
Yeah.
that make a significant difference. But oftentimes, what ends up happening is patients come to me in their 50s or 60s, and they've really neglected their face. It may be that they've been raising children. It may be that they didn't have the disposable income, and so they really, a lot of people tend to kind of neglect themselves and give to others. And I totally respect that and admire it, quite frankly. But what happens is they'll come in their 50s or 60s, and they have done never Botox, never done skincare, never done any kind of muscle stimulation or microneedling, and then they kind of want, well, I just want a little this, and I'm like, okay. And I always start with, they'll have these deep lines here, they'll have this pigment all throughout their face, this dullness, and so it always comes down to, look, I can operate, but if the packaging isn't pretty, it doesn't matter what's inside the box, right? Is the packaging has to
Mhm.
be pretty? And so that's where we got, start the skincare, start the Botox. So the answer is, even if you didn't start in your 20s and 30s, you can start in your 50s, but then, we'll do that correction. Now we've got the laxity. And so now we start looking at things like lower face neck lift, brow lift,
Mhm.
in addition to the eyelids.
And I should
That's where we
mention,
get
you
more surgical.
you only work on the face, right? It's just the
Correct.
neck up essentially.
Yeah, I'm a facial plastic surgeon. I've been
Yeah.
about 21 years, and we've been in our practice has been open since 2008. So yeah, we love San Antonio, our Bernie, our Alamo Heights, really the whole South Texas area, Austin, everything. So we get
Yeah, I
patients
know people
all
from Houston come here to see
over.
you
Yeah,
as well,
yeah,
and other
and they've got,
places.
yeah, exactly right.
And other places. Okay, so I want you to take us through the '60s because I have a personal inclination to be curious about which
So
with
now
that
again,
particular
what
decade.
I kind of treat the 50s, 60s, 70s, and even today I saw an 86-year-old, 86-year
Oh
old,
my gosh!
amazing, healthy as a 50. I mean, she's incredible, and she came because she didn't like her jowling and neck laxity.
Aw, I love
86,
that.
of course. Yeah. So I always say I'm not an ageist. As long as you're healthy enough to have the procedure, there's 60-year-olds that I won't operate on. And I've not operated on 86. I've operated on plenty 82, 83, 80. I think 84 is the
Wow.
oldest I've done. Operate on an aesthetic procedure, that is. And so she came in because of this. Now, I'm not going to tell her she can do tri-lift or Morpheus A because I feel like she'll just throw her money out the window. In those situations, she needs surgery. And so we talk
Yeah.
about the procedure, and that's to lift up the jowls, get the midface higher, get the neck tighter. And now we're talking about 3.5 hours surgery just to get that corrected. And she didn't bat an eye. She was like, okay. And I said, okay,
Oh,
number one, we need to get clearance from your doctor who knows you best and all that good stuff. But if
yeah,
you're healthy, I'm on board because listen, we're going to be surrounded by 100-year-olds, right? In our
yeah.
lifetime, everybody's just staying healthy longer. And we have wonderful, our diet's improving, everything, exercise, medications.
Well, so many things. And I have a question about the Botox. So you started it some years back. Is there ever a point at which the process you get diminishing returns? I mean, should you at some point stop or
Great question. So the way about so people think it's interesting how they name Botox because you think of toxin, right? So I
yeah,
would think, and so there's always that fear, and I hear it all the time of less and less now because it's becoming so common, but of putting a poison in your face. You're not putting a poison in your face. What you're doing is you're putting a protein that weakens the muscles. Why is it a poison? Because at large doses, it can actually shut down your musculature to where you stop breathing and all that kind of stuff. We're talking, so normal Botox units is around 50 to 60 or so, right? A
mhm.
full treatment. I have some people that go up to 100. The extrapolated toxic dose is about 2,500 to 3,000 units.
Oh,
So it's
really?
significant. And it's not a cumulative. So when you're asking, I've been doing it for as long as I have, is there a concern that I'm going to get to that toxic dose? No, because what happens is Botox goes in, it does its work, which is it makes these neurotransmitters kind of go away, which makes the muscles contract,
Right.
but the body replenishes them. So the effect of Botox goes away. There's not this cumulative effect. And so there's no concern that, oh my gosh, I've been doing it for 20 plus years.
It's not building up in
It's
your
not building
system.
up, correct. Now, I will tell you that there are people that it's worked great, 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 and all of a sudden it's like, gosh, I'm not getting the response
That
like
was
I
my next question.
right. Here's the great thing. Now there's other options, right? So there's Dysport, there's Daxify, and so Zeman, which is one we don't carry, but that's another option. So there's different options that, in general, when people are no longer responding like they did, we'll just switch it to a different one, and in general, they will respond. And then they might be on that one for a while, and then they might not respond, and then we'll switch them over to Botox again, and they'll do great.
Well, does the older you get, does your body become, I guess, do you have to have it more often? Does that make sense?
Yeah, no, the answer
It
is
doesn't
you
change?
need to do it more. So who needs to do it more often? Usually my workout folks, the people that are
Ah,
in the
really?
gym, like, hour and a half a day, 5, 6 days a week, their metabolism is always already ramped up. So they break everything else down quickly. They're going to break down the Botox
Interesting.
quicker. And so, or they replenish those neurotransmitters quicker as well. So those are the big workout folks may have to come in like every 3 or 2.5 months if they want to keep the look. But in general, about 80% of our folks, if they come in 3 times a year, it's fine. It's not really age related.
Right.
Now, the stronger the muscle, just the higher the units we have to use because you got to have to hit that threshold that prevents the
Yeah,
movement. If you've been treated and you're still moving, you're really defeating, you're not getting the result you want.
I gotcha. Another question too, because the collagen drinks have become so popular, the powders, collagen products. What do you think about those?
I think one, I wouldn't spend a lot of money on it because a lot of that's broken down in your stomach. So to think that you're going to ingest collagen is going to go into your skin and produce the collagen in your skin is a little naive. Uh, but I'm not God. Obviously, I'm not God. Maybe it does work. I know that you will get stimulation of collagen in your skin directly by doing the microneedling and the Morpheus 8 and things of that nature. So I
Yeah,
wouldn't have a lot of as long as it's not causing you problems, you want to do collagen supplements. I always tell my patients, go, as long as it's not costing you a lot, why not? You never know. But I wouldn't have a lot of
right.
faith in it.
Do you have any new supplements? I know when you do any kind of surgical procedures, you usually get the patients on certain anti-bruising supplements and things like that. Are there any supplements you really like for just skin maintenance?
So there's a guy named David Sinclair out of Boston who's kind of a anti-aging expert, and so
Yeah.
he's done a very logical way of showing the supplements that benefit you that prevent the aging changes, right?
Oh,
And
wow.
so I give this list to my patients. I'm happy to give you the list that I use, but there's things like NMN or NAD,
Mhm.
spermidine, quercetin. There's a whole list of things that I love listening to his podcast and reading his book because it's so logical. And so there's really a phenomenal advancement in anti-aging that's in the past 5 years or so has been tremendous. So yeah, so the answer is yes, and it's too long a list to maybe talk about on this
Yeah, yeah.
podcast, but I'm happy to share it with your listeners.
Okay, I wonder if there's a point at which you've passed the point of no return. I mean, can you continue, I wonder, taking them in your 60s and
Absolutely, bro.
70s and get good results from them? I would
Absolutely.
think.
The thought is so if you can reverse the aging process by 1 year every year, you'll never age.
Yeah, I guess
And that
so.
I mean, it seems like like no way, that could never be. There's a potential, and if you now I'm not saying I don't know when it'll happen, but there's a potential that if you can prevent the aging changes that occur at a cellular level, and that's what
Yeah,
we're doing some of this with this supplementation. Um, that you can then really never age because you keep taking a year off as you age a year.
interesting.
We'll
Well,
see. We'll see.
I hope you'll come back on again and we can talk specifics because I'm interested in some of the other things you do there. I know you all have all kinds of bells and whistles tools, and it would be fun to dive in to
That's
some of
more
the.
on a personal level. We don't do that in our practice just because, again, I'm not the expert, but I just have an interest in it. I think it
Yeah.
goes along well with what I do. As we age, we want to keep looking good as well. So that's why I share the supplements that I personally use because I think there's some science behind it.
Well, and I always enjoy seeing, and some of the websites have it, the befores and afters. Like if you're considering a certain surgical procedure, it's really nice to go on and see real photos of real people that aren't paid models, you know?
You have to
And
do. Would you buy
yeah.
a piece of art from an artist you've never seen their work? Absolutely not. So and I always tell people, a facelift is, someone says, "Oh, I had a facelift, I didn't like it," or it's not something you take off the shelf. There's an expertise there, right? So you want to go to
Mm.
somebody who does it all the time. Like I start every Monday, every Thursday, I'm doing a facelift, I'm doing eyelids, I'm doing brow lift. I do a few procedures and I call it kind of the 100 club. I do over 100 brow lifts, upper eyelids, lower eyelids, and facelifts. And that's what you want. You want somebody who's just doing it all the time. You're an amazing TV personality, radio personality now with your podcast. This is what you do all the time, right? And so you want to go with someone whose expertise is in that and not just general.
Well, you know exactly what you're doing. This podcast world is brand new to me, so I'm on the amateur side right now.
I don't know.
But
You're making it look good, girl. You're making it look good.
you're sweet, Dr. Lopez. Thank you so much. And how can people find you?
The easiest way is our website or our phone number. Our website's lopezplasticsurgery.com. Keep it easy. Our number is 210-495-5771. It's for all locations. We have one number for all of our locations. So yeah, happy to see folks. But really, I think what's great about today, Tanja, is just educating your listeners
Yeah.
on what great natural things are out there to prevent them from looking older or correcting it once it's happened, right?
Well, I didn't realize starting so early was so important. Like I say, I wish I'd met you years ago. Well, thank you so much. I hope
It's
you'll
a
come back.
pleasure. Thank you so much, Tangi.
Get social with us. Follow us on Instagram at Goodtaste TV.